what is liquid biopsy, because it is quite nuanced. There's quite a few applications of it. So if you can maybe do us a favor and give us a little bit of a definition, that'd be really great.
Sure, happy to. And I have to say that I've had so much fun and we've been able to help so many people with liquid biopsy. It's really driven my enthusiasm and a lot of the work that my team and amazing other teams around the world have done in this space. So a liquid biopsy, we most commonly use it to refer to a blood test where we look in the blood and we can find DNA or genetic material or RNA or other things, fragments of DNA that are from broken down cancer cells. So we can use that potentially instead of going in and taking a sample of the tissue with a biopsy or cancer tissue. We can use that to make different types of diagnosis, genetic diagnoses, to look at different things that are associated with the cancer cells that are now in blood. So, in the old days, my patients used to say to me, well, isn't there a blood test you can do to see if the cancer's back or not? We're still not quite there, but we're pretty close. And sometimes I can tell my patients whether or not their cancer's back with blood test. So, there are also other kinds of liquid biopsies. So Dr. Jeff Liu, who's one of my colleagues at the Princess Margaret, is doing some really exciting work looking at what we call breathomics. So you breathe out, he collects all the little droplets and he tries to do testing on that to see, are you at risk for lung cancer? Could you have a lung cancer or not? And then if so, can we find out anything else about that? And so there are many different approaches like that. We heard about a team in BC a couple of years ago who could pick up like lung cancer alterations in people's urine. So really any liquid will do. Blood is the easiest. And, certainly in my research team, people would much rather collect blood than all the other things. So we can use it, to some extent for diagnostic purposes, to some extent in this precision medicine. Does your cancer have mutation X? And so I can match you to treatment Y. So that's really launched. And so studies like the Nile study and our value study that we did here in Canada have really shown the benefit. We find more alterations for more patients, more people get better targeted therapy and can avoid chemo, live longer, and do better. And some of the costs, particularly for drug treatments, are actually less by getting the right person to the right treatment at the right time. You are quite right, though, Lester, there are other uses. So in addition to that sort of diagnostic or, precision medicine use, we can find out when treatment's no longer working. And we can also find out, for example, if somebody's had surgery, if they're at high risk of the cancer coming back, we may find genetic material in the bloodstream. And so that's something called minimal residual disease. And we're currently doing trials trying to find that in people with the earliest stages of lung cancer to figure out, right now we just do surgery and people are followed under surveillance, but maybe these people need more treatment. And so we're actually doing a big study in Toronto across 3 hospital sites with some amazing surgeons. And they are helping us look at patients, look at, whether there's any of this cancer DNA in the blood after surgery, and then can we escalate and give them treatment to get them to cure where surgery has not. So lots of potential uses. Also, even in screening, I told you a bit about breathomics, but maybe there are blood tests that can say this lump in your lung is cancer or it's not, or it's a very likely cancer. So we should do a biopsy in you versus, it's probably not cancer. It's just living in Toronto or other exposures you had in your lifetime. We shouldn't do a biopsy for you. We should watch. So lots going on, lots of potential.